everybody, it's Lorraine from pregnancyexercise.co.nz and welcome to round 2 of our lockdown series free events and workshops for pre and postnatal mums. Now you'll notice Auckland unfortunately are back in level 3 lockdown. So over this period, which is hopefully just 2 weeks, we are going live every morning at 10 o'clock for free workouts, and in the afternoon at around 2 p.m. each day we will hold a small workshop, 10 to 15 minutes, so I don't keep you for any longer, on specific subjects related to pre and postnatal exercise and wellness. And some of you may know also as well that I'm now a childbirth educator, so I facilitate the antenatal sessions that we host up here for Parent Centre on the coast as well. So I will also be giving you lots of tips which I also pass over to my antenatal parents. Okay, so today's session, preparing your pelvic floor muscles for birth. Okay, so what do we need to think about doing right now during our pregnancy to not only help us push our babies out, but also so that our pelvic floor muscles recover postpartum? Because we want to feel normal again postpartum. We don't want to be worried about peeing ourselves. We don't want to be worried that our insides are going to fall out as we chase or pick up our kids. You know, we also need to be preparing them and very much in tune with our pelvic floor muscles. Not only, you know, so we can heal postpartum, so we don't have painful sex, so we can help if there is any tears down there, for everything to recover okay, and so we can get on. All right, so what can we be doing during our pregnancy? First of all, we need to make sure we can contract and relax the muscles. Okay, super important. Often, and I've spoke to midwives here, I spoke to some of the head midwives in New Zealand, that women are doing Kegel exercises wrong, too frequently to what's needed, and not focusing on the relaxed part of the pelvic floor. Okay, please also, as well as you're online, make sure you give the workout the workshop the thumbs up so everybody can see it, and any questions you have, guys, please put them on in the comments. Anything that you need to know or want to know about your pelvic floors during pregnancy, exercise and postpartum, put them down and I will gladly answer any questions. Okay, so first of all, let's see if we can exercise our pelvic floors correctly. Now, I'm sitting on a ball. Now, I don't know if you guys can see that. Okay, I've got my ball here underneath. Now, using a ball gives your pelvic floor muscles automatic feedback. So good. Sitting on a chair doesn't give you quite that feedback. Now, if you haven't got a ball, what I suggest to mums is you roll up a small towel, place the small towel on the end of your couch and sit on the couch with the small towel wrapped up, and that will give you the feedback that your brain needs to know and to tell you that you are contracting and lifting your pelvic floor muscles. Okay, so before we go any further, let's think of our pelvic floor muscles like a ball of muscles, attaching the pubic bone and then to the back. It's a ball of muscles, not just one fiber. Okay, so what we need to do is lift them up and then relax them down. Okay, so we lift up and relax down, and we do that with our breath 99% of the time, how I'm going to teach you, but it changes when we're in birth and about to push babies out. Okay, so I will also go through that with you guys. Okay, so just now everybody's sitting down, keep your shoulders nice and relaxed, take a nice deep breath in, and as you exhale, I want you to think about lifting up your pelvic floor muscles. I teach mums to think about picking up a raisin with their fanny and letting it go. Okay, let's do 4 of those. So pick it up as you exhale and let it go. Now, also being on the ball will tell you if you're squeezing your glutes to help contract your pelvic floor muscles. We don't want that. We want the pelvic floor lift and relax. So super important, and I've got some bands to show you that we feel, okay, because I'm going to show you where we need to be, that we feel the contract and the relax. So contract, relax, okay, we need to get that. So lift up, relax, lift, relax. The reason why we need to concentrate on the relax is because your pelvic floor muscles need to be relaxed in order to push baby out. If they're nice and tense or too tense and tight, it's going to be really hard for us to relax those muscles in order to push your babies out. So really, really important. Up until around about 30 weeks, this is what I get mums to focus on. Contracting and relaxing when they're exercising. Don't need to worry about doing it at any other time because you can overdo it. If you're not exercising, you can do the contracts and relax every time you put the kettle on. Okay, so you do about 10 reps. We don't hold it any longer as well. We just think about the whole time we exhale. 1, 2 seconds. Down. 1, 2 seconds. From 30 weeks, what I get mums to do in the Fit to Birth Mum program is just to concentrate on transverse activation when we're lifting a weight, and we focus on the relaxing of the pelvic floors after 30 weeks. So we start to change it round a little bit. All right, so what we want is, so through our pregnancies, these bands act really well. This is, just imagine this is very much like the bands of your pelvic floor muscles. Okay, and I'm just going to show you this because I'm setting up our sling because that's how they work. They work as a sling. So, through our pregnancy, we want our pelvic floor muscles. This is a 2 kg ball, just to give a little bit, okay? So walking with us, pelvic floor muscles are working with the weight. Contracting, relaxing, nice, functional, automatic. We don't want them too tight so that nothing is moving. We also don't want them super, super relaxed with lots and lots of movement, all right? We want that nice, happy medium, which is perfect function of our pelvic floor muscles, not too tight, hypertonic, and certainly not too loose and saggy. All right, so when we're due to give birth, this is the key. We're not to contract the pelvic floor muscles and pretty much until the very end. Okay, so what we're thinking about doing is when we're pushing baby out, we feel the contraction come in. So we're taking a nice deep breath. I'll probably be in this position. This is where I give birth in a reclined position. Contractions come in, get ready. We're starting to relax the pelvic floor muscles. Feel the contraction. I'm going to start to push from my upper abdominals and I'm relaxing my pelvic floor muscles to start to help descend baby down. That's where we're taking it through. Now we need to, at the very end, and I'm going to talk to you a little bit about preventing tearing, etc., and damage to your pelvic floor muscles just in a moment. So when we're really working and pushing baby down, just as we start to get to the end part, okay, head's in that position, pushed onto the cervix, 10 centimeters dilated, and now obviously we're trying to push baby out. This is where we need to have good control of our pelvic floor muscles to prevent tearing, because often we need to push a little bit and stop a little bit, push a little bit and contract a little bit. So we just might need to contract, lift, contract, relax, contract, relax, as baby's head's slowly starting to come out. This is key for preventing any tears and any damage, okay? It will really, really help reduce the damage to your perineum tissue and to those tissues outside and inside. If you can control it with those little small contractions of your pelvic floor muscles. So really important, you can learn to contract, okay, when you need to. Oh, baby's moving, okay, and relax when your LMC tells you, okay, push a little bit more. Oh, stop. Push a little bit more. Stop, stop, stop. Push, stop, push. Baby's out. Okay, so that will be at the very end. Okay, what else can we do to help prevent damage to our pelvic floor muscles during birth? Okay, so now we've gone through pregnancy. We've been doing how to relax. We can do lots more exercises to help get baby in a good position, okay? If we can get baby in optimal position, pushes down perfectly onto the cervix to help it contract to your, dilate rather, to your 10 centimeters. Perfect pressure, good, hopeful dilation. If baby's not quite right in the position, then we start to increase possible longer pushing, waiting times, medical interventions. And it's these interventions that can start to increase damage to our pelvic floor muscles. We know with forceps delivery that around about 30 to 40% of the mums may experience some damage to the pelvic floor muscles. Also, as well, mums, the fitter and healthier that you are, the longer you can stay in upright positions will also prevent tearing and damage and excessive pushing. Okay, this is what, I'll do this. Okay, so this is almost what your birth canal looks like, okay? So the pelvis actually goes like this at the ends. So if you're lying on your back, you've got to pretty much push your baby back up, okay? So again, lots and lots of pushing, again, can increase certain issues. So the more upright you can be, reverse incline as well, will allow baby to come out a lot better and put more even pressure on those tissues, okay? So it's a lot easier in this position, and obviously it prevents tearing. You don't want to be, they suggest also that increased pushing over 2 hours can also increase pelvic floor muscle damage, as can the size of your baby. Any babies over 4 kgs. Doesn't necessarily mean you will have pelvic floor issues and damage postpartum. That just increase your risk. It also increases your risk of prolapse. Those 4 things are age is a factor, and this is just because of our tissues and cellular repair. We know as we get older, no matter how fit we are, the connective tissue just does not recover as well. The cellular repair is not fast enough, so our tissues start to decrease in tone. Same thing's happening with our pelvic floor muscles internally, so age is a factor. Also, instruments, we know that forceps can increase that damage, pushing for longer than a couple of hours, and baby size. So if you have, say, definitely two or more of those factors, and your pelvic floor muscles, we know, something's not right. I go through all the different things, through those warning signs postpartum, which I will go through in a different event. We need you to get in touch with a women's pelvic floor health physiotherapist pretty soon after birth, so we can get on to things very, very quickly. Any questions, guys? Let me know. Like I say, these 10 to 15 minutes events every day at 2 p.m. I want them to be quite quick, full of lots of tips for you. I know it's a lot of information, but things that you can put in and work on throughout the day. So what I want you to take away is preferably relaxing your pelvic floors a little bit more than what you are in your pregnancy, trying to think about breathing baby out and working with your body as you go through labor, stay in upright positions, talk to your LMC as much as you can about being on your feet upright to decrease the chances of tearing. Minimal interventions, you can change those around. You know, if you've got your obstetrician there, if you don't want the forceps and you'd rather have the ventouse, which is a little bit better for mum's pelvic floor muscles, you can ask to try that first if you have a choice and depending on the situation. All right, so hope you enjoyed today's quick little session. I can't remember what tomorrow's is. I'm pretty sure it's diastasis. All right, okay, they're all going up. We've got the timetable pinned to the top. Please like and share. Thanks, Pip. Okay, please like and share the videos with your friends. Midwives, you're welcome to share them out also. Take care, everybody. I will talk to you all soon. Again, any questions, let me know. Remember, we have the coupon code LOCKDOWN that you can use whilst Auckland is in our level 3 lockdown, so you get 30% discount off the programs. Thanks, Jess. Okay, everybody. Thanks, Abigail. Thanks for watching, guys. I will talk to you all soon. Bye, everybody.